Hi friends, today I will teach you borderline lepromatous leprosy. That is very important topic as far as pathologist and exam point of view. Right? Leprosy is caused by Mycobacterium lepra bacilli. Right? It is mainly the skin infection. The leprosy can be of the four type. Either it can be tuberculoid variant or it can be lepromatous variant. It can be tuberculoid leprosy or it can be borderline tuberculoid leprosy or it can be lepromatous or borderline lepromatous leprosy. So how will you differentiate between this tuberculoid variant and lepromatous variant? That is most important. First of all, you can able to differentiate whether it is tuberculoid leprosy or it is lepromatous leprosy. So remember, the basic distinguishing feature is the granuloma formation. Remember that granuloma formation. In the tuberculoid leprosy, why it happened? Because your immunity is strong. Whenever your cell mediated immunity is strong, there will be formation of granuloma, and so the skin lesion will be of the tuberculoid type. So if granuloma is seen, it is the tuberculoid leprosy. Now if the granuloma is absent and you can able to see only macrophages, right? If there is a presence of only macrophage and the granuloma is absent, then your leprosy will be lepromatous leprosy. So that is the main distinguishing feature of the leprosy. If your cell mediated immunity is present, then you will develop granuloma, and so there will be cell mediated immunity. If so, you will be develop tuberculoid leprosy. If your cell mediated immunity is less, it is weak, then you will develop lepromatous leprosy. So let's start the discussion on the lepromatous leprosy, borderline lepromatous leprosy. So this is a summary, right? Etiology is Mycobacterium lepra, and it is also called is Hansen disease. The other name of leprosy is Hansen disease. Your cell-mediated immunity is poor in lepromatous leprosy. Now, what can be the clinical presentation of this lepromatous leprosy? So there will be presence of hypopigmented skin lesions, right? And there will be presence of erythematous border surrounding it. So central one hypopigmented lesion, and surrounding it there will be erythematous border. Sometimes what happen, patient can present with papules or plaque as well. There will be loss of sensation in that particular area. Sometimes the lepromatous bacilli can invade the erector pili muscles, and sometimes it might present with nodules. So nodules can also be seen. So what is the feature of lepromatous leprosy? The lepromatous leprosy is having macrophages in the dermis, and there will be absent of lymphocyte. That is the feature of lepromatous leprosy. Remember, there will be presence of macrophage and there will be absent or very few lymphocytes. But when the focus will show the macrophage as well as equal number of lymphocytes, then your diagnosis will be borderline lepromatous leprosy. And you can confirm the diagnosis by white varicose stain, which will show the bacilli as a red color, right? So this is the positive white varicose stain. You can able to see the acid fast bacilli. Pinkish red color acid fast bacilli can be seen, right? So that is regarding the white varicose stain. Now this is the microscopic focus of the leprosy. I have to show you in the 4x. This was the lepromatous foci, right? We have inspect it in a 40x view, high power view. So what can you see in this figure? Just see, these cells are having clear cytoplasm, right? So all these are macrophage. These are the macrophage cells with the clear cytoplasm. So there will be presence of macrophage, first thing. Another one is there is a presence of many lymphocytes. You can able to see the lymphocytes as well. Can you appreciate? These are the lymphocytes. So whenever the macrophages and lymphocytes are seen, your diagnosis will be borderline lepromatous leprosy. Sometimes what happens, these bacilli are abundantly invading the macrophage. Sometimes macrophage is fully studded with many Mycobacterium lepra bacilli. So in that case, that focus focal collection of abundant lepra bacilli in the macrophage cytoplasm is known by the different name, that is globi, right? Macrophage is distended by many lepra bacilli, that is called as globi. It's a collection of lepra bacilli, right? Here you can able to see the globi focal collection, right? This is the globi collection of lepra bacilli. So that is regarding the leprosy. What can be the treatment of this leprosy? The treatment usually involve given the antibiotics in the form of rifampicin, or you can give dapsone and clarithromycin. These three drugs are used in leprosy treatment, and the treatment may vary from 6 to 8 months as well. So you have to take this treatment continuously to eradicate the leprosy. So this was regarding the diagnosis of the leprosy, right? Again, I am summarizing. You have to look for the focal collection of the macrophages. This is the focus of leprosy. If you will inspect it in 4DX view, then you can able to see the macrophages. This is the cells with clear cytoplasm. These are the macrophages. You can able to see the macrophages and many lymphocytes, like small round cells are lymphocytes. If these two cells are seen, the diagnosis is borderline lepromatous leprosy. And we have confirmed the diagnosis with the help of white varicose acid for bacilli can be seen. So that is regarding the diagnosis of lepromatous leprosy, borderline lepromatous leprosy. Hope my video will be beneficial to you in making the diagnosis of lepromatous leprosy. If you like my video, then subscribe my channel and press the bell icon so that you can get notified whenever I am posting the new video. Yeah, thank you very much.